The debate I was involved in was who should take care of heart failure patients. You know, can PCPs, primary care doctors, internists take care of heart failure patients? Or can general cardiologists like myself take care of heart failure patients? Or should you have a super specialist? You know, there's a board exam now in heart failure. Should only those people take care of heart failure? I argued it's impossible to have heart failure specialists take care of everybody. There's only 1,000 in the country. You know, there's 5 million people with heart failure. The numbers aren't going to work. And to train enough heart failure specialists, we're talking about, you know, tens of millions of dollars, and that's just not going to fly. The way they do it is people voted. Okay, so they vote ahead of time and they vote afterwards. So when they vote ahead of time, 31% of people were in agreement with me and the rest were in agreement with her. Afterward, it was 50-50. So the moderator said, that means you convinced more people than she did. I argued successfully. Yeah, cardiologists and internists, if they follow the AHA-ACC guidelines, if we push really hard on people to follow the guidelines, and that, by the way, is a good quality measure to follow, the results are good. And we've seen that in a lot of areas, that when you push the docs to follow the guidelines, the patients do better. I defined general cardiologists as being in the group with the PCPs. And she was showing data that said cardiologists are better at taking care of heart failure patients than just internists. And I think that's correct. But we don't need heart failure specialists taking care of the heart failure patients. A general cardiologist can do that, and often in conjunction with the hospitalists and with the primary care docs. So of course, every patient that comes into our hospital with heart failure gets a consult. You know, many of them end up on the hospital service or the internal medicine service. They get a consult from the cardiologist, and if we think it's more than very mild heart failure, we're going to have that patient come back and see us in clinic. But most of those patients will be seen by general cardiologists, not by the heart failure specialists. We only have really, you know, 3 heart failure specialists. So, and out of you know 25 cardiologists. So most of them are going to be seen. What I called myself is a general garden variety cardiologist. I get paid for an outpatient visit the same as a PCP, so you know, I'm not a super specialist in heart failure, but I'm comfortable taking care of those patients. I know the guidelines. I've taken care of a lot over my career. I think I can get a good result, and I can certainly lead the internists and the family physicians in how to take care of that heart failure patient. Absolutely, yes. The problem is, that those patients, even with the very best opinions, often don't do very well because they're very advanced in heart failure. So we have a lot of fancy devices and so forth that are very expensive, improve some people, lots of complications, and so and that's what Maria Rosa is. She's a certified, board-certified heart failure specialist. So the affirmative side, which was my side, that yes, generalists could take care of it. I defined the general cardiologist as right in there with the hospitalists and the internist, and she wanted to say, oh no, a cardiologist was a heart failure specialist. Well, we're not all heart failure specialists. So it was an argument a little bit about terms.